Hi everyone, could you guys hear me out there?
Yes.
Yes.
All right, thank you so much for the responses. So, hi, my name is Alex and I'm your MC for tonight. Firstly, I would like to inform you all that this talk will be recorded so that we could post in social media such as YouTube and Facebook, all right? And you're highly encouraged also to open your webcam too. Come on guys, don't be shy. Just open a webcam just like me, all right? Oh, yeah, I saw some. Hi. Okay, this talk is one of the World Spine Day 2020 events, which is held by IMU, International Medical University. There are actually more fun events such as PUBG, Fitness Challenge, and Yoga Challenge. And guess what? There are more and more amazing prizes awaiting you. So please do support our events and also don't forget to follow our Facebook page, YouTube channel, and also Instagram. And please do watch our daily video in YouTube. Thank you. First and foremost, I would like to express my gratitude from my bottom of heart to all of you on attending this webinar. So for tonight's topic, I guess all of you already know what it is, right? So what is chiropractic? I'm pretty sure that some of you might have heard of chiropractic or even went to visit a chiropractor before. Okay, so do you really know what is chiropractic? Does everyone know? Yeah. Okay. So it's okay if you don't know the answer because we are proud enough to have Dr. Angus to give us a talk about it. But before the talk, I would like to briefly introduce him. Dr. Angus is a qualified chiropractor who has graduated from IMU. He likes to study chiropractic in a different point of view, and he's a very curious guy. Nevertheless, he has been attending different types of seminars, including Gonstead, Diversify, Cranial Nerve Technique, Scroff, Scoliosis Technique, and etc. And I believe that this is what makes him to have the most follow-ups during his internship in IMU. Upon excelling in academic and also clinical skills, he has now owned a chiropractic center, which is known as BP Chiro. Yeah. So this is the address and purpose of company. Please take note that his clinic will be open only on the first 2 weeks of November. So what are you still waiting for? Don't forget to drop an appointment with him. Before I pass to Dr. Angus, please make sure that your microphone is muted and there is no interruption allowed during the talk. If you do have a question, please put them on the chat box because Q&A session will be after the talk. I repeat, please make sure your microphone is muted and there's no interruption allowed during the talk. If you do have a question, put them in the chat box because Q&A session will be after the talk. So are you guys excited for the talk? Are you guys ready for the talk? Now, please welcome our speaker of the day, Dr. Angus. Let's give him a round of applause, guys.
Hi guys, can you guys hear me? If you can hear me, you can use the reaction button at the bottom of the toolbar and just put a good or a clap hand sign for me to see whether everyone can actually hear me. Okay, everyone can hear me, nice and clear. Okay, so I will also appreciate if any one of you can switch on your webcam to let me see your face, so that when during my talk, during my sharing session, I can see like whether you are confusing, whether you are exciting, or whether you don't like or like my talk, my sharing. Okay, so if you can open up your webcam, they will be very appreciated lah. So firstly, I would like to really thank you, WSD World Spine Day, for giving me this opportunity to share with you all what really is chiropractic. It's actually what really is chiropractic. Let me share my screen first. Yeah, give me a second. Share. Okay, everyone can see my screen? If you can see the same thing, put a reaction or like a reaction under the toolbar there. Just put a reaction. Let me see whether you can see. Okay, good. Everyone can see, huh? Okay, so before I start my sharing, can I know how many of you are chiropractic student? If you are chiropractic student, you can type in your semester in the chat box, so I can see how many of you are chiropractic student. If you are semester 1, just put 1, 2, 3. If you are graduated doctor, just put doctor. Okay, DR or DC. Okay. Okay. So if you are non-chiropractic student, please just put no in the chat box, so to let me know whether how many of you are chiropractic student or how many of you are not chiropractic student. Okay. Form 5. Okay, we have a Form 5 student here. Pretty lots of Sem 1, Sem 5, Sem 6. Very good. Okay. Okay. So let me start my sharing now lah. Okay, first, what really is chiropractic? Although there's a Malaysia English slang there, but really, I want all of you to ask yourself what really is chiropractic. You see, why is my topic not what is chiropractic? Is what really is chiropractic? Because throughout my chiropractic journey, I actually always think of this question: what really is chiropractic? Okay, but then before I go in depth in that, I'll just briefly introduce what is chiropractic. Basically, the history of chiropractic is 120 something years ago. So there's a guy named D.D. Palmer, Dr. Palmer. So he performed a adjustment spinal manipulation on the patient thoracic spine, and straight away the patient can hear very clear. Okay, before that, the patient has partially deaf or almost no hearing ability, and after the adjustment, it's actually come back already, the hearing ability. So that's the first chiropractic adjustment happen lah, takes place in US. So from years and years, days and days pass on, chiropractic has been developed a wide range of different kind of technique, but the main concept, the main purpose of chiropractic are still correcting the alignment of the spine to achieve a wellness purpose, or to remove the nerve tension or nerve interference in your body. And in the old saying, it's like to release the innate intelligence in your body. Okay, so this is basically what chiropractic is lah. But if you don't know about chiropractic, you see, in the past, they always see chiropractic as a miracle hand. Okay, all the chiropractor, it's like how they advertise is like one adjustment can cure everything, or single session of adjustment can actually cure you from any disease. But from the modern science, modern medical point of view, it's actually not true. Okay, this statement or this kind of advertisements is actually over exaggerated already. Okay, so when you come to a chiropractic clinic or you visit a doctor of chiropractic, what do you need to expect? You at least give us some patient, okay, 3 to 6 visits. Okay, then we can maybe your pain skill or your condition can reduce more than 50 or 60%. Okay, that is our goal. That is our optimal goal. Okay, so now what really is chiropractic, guys? First of all, I have to ask all of you, what do you think chiropractic is? Okay, so I'm just going to pick up three person in different semester to see difference, how different semester interpret different point of view in chiropractic. Okay, so in semester 1, chiropractic student, anyone want to share like what do you think about what is chiropractic for you? Semester 1 student, hello. Okay, I think everyone is too shy to like give their own definition. Never mind. Then maybe we can ask semester 3 to semester 5. Anyone want to share? Like, what do you think chiropractic is? Still don't have? Semester 6, 8. Semester 6 to semester 8. Anyone want to share? You can open your mic or you can type in the chat box. Okay. I saw World Spine Day president can share. Okay. Practice by hand. Okay. Maybe we would like to invite World Spine Day president to share about his or her point of view about chiropractic. Okay. Come. Which one already?
Hi.
Okay.
From my point of view, chiropractic is practiced by hand with the high velocity, low amplitude adjustment to adjust back the restricted joint. Yeah, that's all.
Okay. Okay. So actually, if all of you can have an interaction with me, that would be best lah. Okay. By the way, okay, but you see, when I asked around semester 1, when during my school time, I asked my juniors semester 1, semester 3, semester 6, or my senior semester 8, they always give me a very different answer. There's no definite definition for chiropractic. Your chiropractic may be different from my chiropractic. It's a totally new concept, you see. What we do is similar, but what we think is actually different. And also what we think actually define which kind of chiropractor you are. So this is the main thing that I'm going to share for today lah. Okay, so for me, what is chiropractic? Chiropractic is actually a journey to find yourself. To actually, within these 4 years of time, it's actually a journey to find which kind of doctor you want to be, or what kind of practice that you want to be, or what kind of technique that you would like to use. Okay, so let me continue. So in chiropractic, there are 3 pillars of chiropractic. Anyone knows what is 3 pillars of chiropractic? You can type it in the chat box. Let me see. Okay, what 3 pillars of chiropractic? Not articular pillars lah. I saw someone say articular pillars. Okay, so yeah, science and art. So what is 3 pillars? What are those 3 pillars? Which is science, art, and philosophy. So a good chiropractor that actually can balance out these 3 elements in their own practice. If you cannot balance the element, right, you will be a very extreme chiropractor. Not to say a bad chiropractor, but a very extreme chiropractor. Okay, so in science, which means that it's a basic science. Okay, very, very basic science, like the facts or anatomy, physiology. But in art is how do you examine the patient? And philosophy is talk about why. Okay, why are you adjusting the patient? Why are you treating the patient? Why are you using this kind of treatment? Okay, so let me carry on. So what is science? Science is actually facts like anatomy, physiology, biomechanics, radiologies. And I want all semester 1 to semester 2 students here to be very, very focused. Why? Because science is a very basic element in chiropractic. Without science, we are nothing different than maybe a bone setter, or maybe other profession who doing spinal manipulation. Our spinal manipulation, our examination, it's all based on basic science, anatomy, physiology, biomechanics, radiology. So if you are in semester 1 or semester 2 student, you have to study extremely. I would say when I was semester 1, semester 2, I study every day, continuously study 1 and 2 every day after our lecture, like around 3 p.m. or 5 p.m. I study until midnight 12. And then during semester 1, semester 2, that's the time we are most raging one. Okay, we work very, very hard to get through the anatomy, to get through the microbiology, the pathology. And just to let you know, semester 2 is the hardest. It's the hardest time you can go through. Okay, but then if you pass through semester 2, I'll tell you, from semester 2 onwards to semester 8, nothing can defeat you. Okay, so when you are in semester 1 and semester 2, don't care about anything. Don't care about adjustment. Don't care about anything related to art or philosophy. Just study the basic science. Or else, if your focus are divided by arts or philosophy or other element, you will be quite hard and you will be facing a hard time in passing semester 1 and semester 2. And then here's a tips. The best way to study like those kind of basic science is actually, for me, it's a group studying. So for example, anatomy, during we are in semester 1, we used to camp in MMS. Okay, everyone know, it's still called MMS? Yeah, the place where a lot of like bone model and muscle model, okay, in the library. So we always camp there, and then we ask each other question, and we studying it in a group, and then we teach each other. We share the knowledge within each other, between each other, so that that's the quite more interesting way to learn anatomy, to learn basic science in the semester 1 and semester 2. But then, right, yeah, of course, MCO we cannot group together, so we can use Zoom. You see, MCO we cannot group together, so that we use Zoom, right? Okay, so this is all about semester 1 and semester 2. So also, apart from studying, I want you guys to understand what you guys are going to face in the future semester, which is in the semester 3 to semester 5. Okay, so arts. Let's talk about arts. In arts, it's all about how do you adjust the patient, which line of drive, how to palpate, okay, how to do proper examination. Guys, this is a very important part, okay, because when you finish your semester 2, basically all the anatomy knowledge, the basic science in your head already, okay, unless you fail lah. Okay, so when you pass semester 2, confirm all the anatomy, you are very clear already. Close your eyes also, you can draw all the muscle, know all the insertion, nerve, and stuff. Okay, so when you come to semester 3 to semester 5, this is the time where you explore to the philosophy and learn what is the art of chiropractic. So I believe that start from semester 3 to semester 5 onwards, we're starting to learn what is physical examination, what is the neurological examination, and how to palpate the joint, and then motion palpation, and then how to adjust cervical, thoracic, lumbar, and even extremity in semester 5, right? So in this period of time, it's the time where you can expose to different technique. Okay, not only the technique which taught by the lecturer in IMU, but then in IMU, right, I can say most of the lecturers that have different kind of philosophy, and their technique is very, very different. Okay, so this is the time, semester 3 to semester 5 is your honeymoon time. Okay, I believe everyone been through semester 3 and semester 5, we will be knowing, because 3 to 5, you have lesser work, you have lesser assignment, you have lesser examination. Okay, so this is the best time for you to read out all the books. Okay, for me personally, when I'm in semester 3, I start to explore many different techniques like Gonstead, diosify, activator method, SOT, and drop piece, Thompson drop piece, Logan, Webster. I start to read out their books and watch some of their videos. So one tips for you guys is that IMU library is a very good source for looking your own philosophy and different technique system. Okay, there's a book in IMU library that I always read. is the book's called Technique System in Chiropractic. Okay, I just type in here, Technique System in Chiropractic. I strongly recommend all of you go and read this book. Okay, so during my time when I was in semester 3, I'm choosing the pathway of, I haven't choose any pathway yet lah. So I try to explore to many different kind of technique. But then I try to use their way of palpation, their way of examination. Okay, so this is the time where you expose to all of this technique. It's the art of how. So after you pass your semester 5, now everyone have been very kamchong already, very nervous already. Because why? In semester 6, it's your junior clinic. And semester 7 and 8 will be your internship already. Okay? So when you go to semester 6, you need to have at least, okay, a little bit about philosophy, your own philosophy. Or you at least need to know what is the difference between different technique and what is their point of view while treating the patient. What are their different approach while treating the patient? Okay, or else you are wasting your semester 3 and semester 5 to semester 5. Okay, I'm serious. But then if you have already wasted your semester 3 and to semester 5, you can start it by now. Okay, so now that's the best part, philosophy. Okay, what is philosophy? Philosophy is all about why and when, who you are, who are we treating, why are we treating, why are we looking this disease in this point of view, why are we looking the spine in this point of view, why are we using the x-ray, why are we not using the x-ray, why are we using the activator, why are we not using the activator, when do we adjust or when do we not to adjust? Okay, anyone here have asked you guys have asked yourself about all these questions during your semester? If you've been asking yourself this question, type number 5 in the chat box, let me know. Okay, so in my semester 6, I would say semester 4 to semester 6 is the time where we lost the most. Okay, we don't know why are we doing this. A lot of people tell us that chiropractic is actually pseudoscience. Some Chinese tell us that chiropractic is psi theta. Okay, it's a theta in modern medicine. Okay, so this is the time where you try to find who you are and what is the difference between you and other practitioner. What is the difference between you and other doctor of chiropractic? Or what is the difference between you and a physio? What is the difference between you and osteopath or medical doctor or or the orthopedic surgeon? And what is the difference between you and bone setter? What is the difference between you and theta? This is the time that we encounter the most. The most of the people will ask us this question. What is the Dr. Angus, Angus, what is the difference between you and physio? Hey, you and the bone setter, you know, the always make sound one, the bone setter, what's the difference? Are you guys the same? Okay, when you are in semester 6, you always encounter this kind of question. And then when this kind of question come in, okay, that's the time where you feel very lost. Because if you are a negative thinker like I was before, I always think that chiropractic has no different than the theta. Okay, has absolutely no different than the theta. Because why? We are adjusting the spine, right? The theta also adjusting the spine. What are the difference? Right? Because that time I have no philosophy in myself. I don't know why are we adjusting this patient. I don't know why are these patients seeing me instead of seeing a medical doctor. I don't know why. So yeah, by the time when I was semester 5, I tried to read out as many books as I can but not the whole books, just the philosophy part or the history of chiropractic. And then when I was in semester 6, I remember semester 6 or semester 5, one of our doctor actually showed us a video about the war between chiropractic society and the medical society back in 1980, I don't know how many. Okay, so after watching this video, I try to figure out my own philosophy and why are we adjust the patient and which technique that I would utilize. So of course, I'm using diversified technique now lah. Like in IMU, it's quite, because in IMU we don't really learn much about other techniques. So if you are not learning it in a practical way, try to learn it in a theoretical way. So try to read through all the books from every single technique. Try to ask the doctor who practice this kind of technique. Like for example, Dr. Phil in IMU, Dr. Phil is practicing Thompson technique, Thompson drop technique, and then he practice activator technique as well. So we can ask him about this kind of like technique. And then I think Dr. Kama is doing diversify, and yeah, most of them are diversify doctor, but they have something specialized in themselves lah. Okay, so you see, every chiropractor is different. When the patient come in to see you and when the patient come in to see me is absolutely different. Our adjustment are different. Our way of looking the patient are different. Okay, so that's why you have to stand out. How to stand out among all the doctor of chiropractic is that you have your own unique philosophy. Okay, so this is the importance of philosophy. So from semester 5 onwards is the time when you try to search, when you try to figure out what is your philosophy. Okay, until now, who have already developed his own point of philosophy? Can you put it in the chat box? If you have already developed your own type of philosophy. Yeah, by the way, if you have any question or you have anything curious about me, then you can type it in the chat box. Later, our MC Alex will summarize everything and we will be talking more about the question and answer in the Q&A session at the end. Okay, so so let's carry on. So little tips about philosophy from me, okay, to all of you. Okay, so I will share about 3 of my own philosophy that I have developed throughout the semester lah. Okay, so first, chiropractic is all about finding and shaping yourself. You see, this one I explained already. So common chiropractic technique: SOT, chiropractic biophysis, Blair, Logan, upper cervical, cranial nerve, Webster, activator, Thompson, Gonstead, and diversify. Okay, so these are the very common chiropractic technique that I have read through their philosophy and how they approach to the patient. Okay, so you guys can have a look lah, or if you want you can take a snapshot on it also can. Okay, so in philosophy, why do you adjust? You see, SOT adjusts patient in a different way. They look the patient in the relationship between their occiput and their pelvis. And then Blair technique or upper cervical technique is about upper cervical. Cranial nerve technique is they use activator in cranial nerve technique. Webster is for pregnancy, and activator Thompson drop, Gonstead, or diversify. Okay, so you are not required to practice solely one technique. Okay, this is the point. Don't be narrow-minded. Okay, because there's so many different techniques out there, and every single technique actually works. So you have to pick which technique that is most suitable to you. Like I have a friend who is I recently knew a chiropractor who practicing activator technique. I asked her why is she practicing activator technique instead of like manual adjustment and stuff. Then she said she prefer activator technique because it produces less strain to the doctor itself, and it's actually focused more on neurological base. So it's very gentle adjustment by using an instrument, and very effective like during her practice. So she become an activator doctor. So you will never know until you actually seeing a patient. So my advice is explore to as much technique as you can. For now, I still haven't decided which technique I'm using now. So like all of the technique, all of the seminar, I will go and attend and see which one is the most suitable for me. Okay, so here's kind of a question. See, among all of these techniques have their own philosophy. What about yours? Okay, why do you adjust the patient? Why? Okay, so there are 3 points of view in adjusting the patient. The first one is biomechanical point of view. So, but what does it mean by biomechanical point of view? Is that we adjust the patient's spine to correct the alignment. Okay, so to relieve the nerve tension, to have patient to have better movement after the adjustment, and then correct all the misalignment. Okay, so what I'm seeing now is most of the chiropractor, they are actually having this kind of concept biomechanically. I adjust the patient, I correct the alignment, and I relieve the nerve tension. But then scientifically, it's very hard to say whether you are moving a bone or not. Usually through post check, right? But then a lot of time, yeah, here comes the science. Here comes the art. How do you motion palpate? Are you motion palpate it correctly? Is your pre-motion palpate and your post-motion palpate is correct? Is the same? Is reliable, or is it constant? Okay, a lot of time we tend to cheat ourselves. Like you see, when I was in semester 5, I'm learning pelvis adjustment. So after the adjustment, right, when I heard the cavitation, I always have the mindset or have the stereotype, how to say, I have the feeling of this adjustment has done, the bone has moved. So when I post check, I use a different attitude towards the patient. So you see, when I palpate the patient, I feel like it's moved a little bit. Oh, it's moved. But when the other practitioner come and motion palpate, then you realize it doesn't at all. It doesn't move at all. Okay, so here is the expectation. Yeah, practitioner expectation will play a very big role in this biomechanical concept lah. So we have to be careful lah. Because when I was in semester 8, after I adjust the patient, I actually call one of my supervisor come in and check for me. When they check, he said the adjustment is actually not set. Yeah, so it's until semester 8, I'm still figure out like what is my philosophy of adjusting the patient. Okay, the second point of view is the point of view where more and more chiropractic start to develop chiropractor, okay, which is neuromechanical, adjust to stimulate. Okay, usually from the research that I read through, the high velocity and low amplitude thrust into a joint can actually stimulate the muscle spindle. Okay, and then or stimulate the cranial nerve or the central nervous system or peripheral nervous system. So like activator technique, applied kinesiology technique, they are actually having this kind of mindset where adjust to stimulate the spine. Yeah, so you see, biomechanical and neuromechanical, they actually have some sorts of conflict. Okay, they contraindicate with each other. You see, when a joint is stuck, do you adjust the joint? Of course, you adjust the joint. But if the joint are not stuck, will you adjust the joint? Yeah, here's the question you have to think. Because during neuromechanical way of adjustment of thinking, we are most likely thinking of central nervous system or peripheral nervous system or like cranial nerve. Like for example, in cranial nerve technique, when we examine the cranial nerve through the AK reflex point, and then we found that, oh, there's a lesion or there's a dysfunction in cranial nerve 3. So it's the same procedure. We adjust the T2, T4, and T6 to stimulate the parasympathetic nerve. And at that time, your T2, T4, and T6 doesn't have to be stuck. Okay, we adjust for the purpose to stimulate the joint, to stimulate the nervous system instead of correcting the biomechanics. So here you will have a little bit of conflict about this. So you have to figure out whether I'm adjust to correct the alignment or I'm adjust to just to stimulate either the parasympathetic or the sympathetic or to stimulate the function of your organ. Okay, so the last one is mechanochemical. So this is kind of a very new concept for me as well, because recently when I've been reading about some books about philosophy, they actually pop up that adjust to trigger the cell proliferation or to improve the what you call that, the immunity of the patient. But then this is not scientific proven lah, or adjustment through the research, they say adjustment doesn't increase any kind of immunity in our body. So don't tell your patient that adjustment can improve the immunity. Adjustment can actually relieve or stimulate the nerve, and then to help your body to heal better, or instead of increasing the immunity of your body. So in this mechanochemical concept, right, it's actually to adjust to trigger the cell proliferation, or to change, to alter the proliferation of the cells. So it's a very new concept. If you are interested in this concept, you can go and look it out lah, because I have not really applied this philosophy in my patient yet. Okay, so next you have to define what kind of practice you want to be. Okay, especially from semester 6 onwards, because when you go into internship, that's how makes you a different chiropractor. That's how makes you a different chiropractic intern. Okay, the first one will be, you want to be a medical based chiropractor or a chiropractic based chiropractor. Okay, anyone know the difference between these two medical based or chiropractic based? If you know the difference, you just type in the chat box lah. So in IMU, we always teach you in a very scientific and very medical base. Okay, so for sure, when you go into intern, you have to prove every single research in your treatment that you give. Why do you adjust the patient? Why are you using TENS? Why are you using ultrasound? Is there any scientific background, backup for your treatment? So in IMU, that's how we teach you, because if you practice in a medical way, it is more safe, relatively to say, for us, doctor of chiropractic, because when we adjust and we can prove our treatment, if we are facing a lawsuit, usually we have a lot of like research to back us out. Why are we using this treatment? Okay, so but then in chiropractic based practice is actually after you graduate. If you decided to change it into a very chiropractic based, it's like a straight chiropractor, or you adjust to see the biomechanics of the spine. Okay, so this is a different law. You have to decide which kind of practice you want to be in the future. You want to be a biomechanical base, or you want to be a neuro based? For me, I prefer to be a neuro based chiropractor, because I see the spine I see a body as a whole, and of course, a nerve can have a very big impact in our body. So this is why I want to be a neuro based chiropractic also, because a lot of chiropractor is biomechanical based. So I want to stand out, and I want to be a very different chiropractor. So I tend to study in a lot of like neurological conditions, or any treatment related to neuro, like cranial nerve technique, or like adjust to stimulate. How does a parasympathetic system affect your organ? How does a sympathetic system, how to stimulate the sympathetic system, how to stimulate your vagus nerve, how to stimulate your cranial nerve to have a better function. Okay, so the next one is straight and mixer. For now, in the modern time, I think straight chiropractor has no longer exists. Okay, because straight chiropractor in the past, when D.D. Palmer made a definition on it, is that we used to think, a straight chiropractor used to think every single disease are from spine. Okay, they don't even believe in bacteria, in germs, or in virus. So they believe in every single condition, every single disease is from the nerve interference, which trap your innate intelligence of the body and causing the disease. These are the difference between straight and mixer. It's not saying that, oh, you are using modality, then you are a mixer. you are giving exercise, you are a mixer. No, it's actually the philosophically different. When you are a straight chiropractor, usually I've seen a lot of like activator practitioner or like gone state practitioner. They usually claim that they are a straight chiropractor, but actually I can only say that they are a chiro-based chiropractor instead of medical-based chiropractor. It's not a straight or a mixer. So usually straight chiropractor, yeah, back then when Didi Palmer say about straight and mixer, they say in all of the chiropractor in US, there are only 3,000 straight chiropractor left. And then I think until now, we don't have any straight chiropractor anymore because modern medicine actually kicks in, and a lot of facts, a lot of research has shown us the virus, microbiology. Okay, that's why this just to let you know a little bit about the history lah. And the last one is the most important. You want to be a patient-centered chiropractor or a doctor-centered chiropractor. Okay, why is it very important? Because for me, my definition of patient-centered chiropractor is that I will give whatever treatment that the patient need. Okay, so for example, like patient having a muscle spasm on the calf, so I will, except from adjusting the spine, okay, as adjusting the ankle, adjusting the knee, I will also give some supplementary advice, and I will take my time to listen the patient needs. Okay, for me, doctor-centered chiropractic is more like a it's like I'm practicing gone state. So I adjust everything using a gone state 5-step. I don't listen to patient. Patient said here pain, it's okay, it's all from the spine. I will just do my job and then send the patient home. Doctor-centered chiropractic actually happen in a lot of business where they have high volume, and then they tends to have lesser time with patient. And patient-centered chiropractor is more like a family chiropractic or a family practice chiropractor lah. Okay, so my second philosophy is that no technique is superior than another. This is a very important philosophy to no technique is superior than other. This is a very important philosophy, and I would like all of the students to take note of this. Okay, because you may hear, diversify, you have a lot of rotation in the spine. Okay, I think gone state is better, or we adjust the biomechanic, and what happened to the nervous system? Why don't we just stimulate the nervous system? So like activator techniques is better than diversify. Drop Thompson technique is better than gone state. A lot of this kind of statement come out. I think recently IMU is quite open already lah. So most of the students, I believe that you guys know this this statement, no technique is superior than another. So I would like to quote Dr. Clarence Gonstead. He said, remember that chiropractic always works when it does not seem to. Examine your application, but do not question the principle. Actually, there's a lot of stuff happening in this statement, in this quote. So a lot of how to say not to. Okay, in this statement, I will just tell you how I interpret, okay, this statement. But how I interpret doesn't mean that that's the actual meaning from Dr. Karen Gonstead. Okay, so they want everyone clear. So as you see, remember that chiropractic always work. They say chiropractic doesn't specify in which kind of technique. It doesn't say remember that Gonstead is always work. Remember that activator is always work. And when it doesn't seem to, examine your application. Doesn't say it's about Gonstead, but do not question the principle. Don't question the technique or the system that you are actually following now. Okay, so this is how I interpret. Chiropractic care definitely work. Yeah, you see so many people receive chiropractic care, and then they seem to have very good effect. And then if they are not responding to chiropractic care, the chiropractor will refer them to a specialist, to an appropriate specialist for further on their condition. Okay, so chiropractic care definitely work. However, if you should always follow the principle of the technique used. For example, like you're using a drop table, Thompson drop table. Okay, you should always follow what the philosophy in the drop table, how the technique should be conducted, where should you contact, how to test the spine. Okay, instead of you using, or maybe like for example, you using a activator technique, then you do the basic scan. After you do the basic scan, you adjust the place where you use the manual adjustment in the activator analysis. So here kind of crash with each other. So if you are using one system, just use that system, what the system say. Okay, so every technique has their own strength and weakness. So I will say one example, which is Thompson drop table, where they have a sacrum rotation test to see whether the sacrum is having a apex to the right or apex to the left. But then in Thompson technique, right, they don't usually see the sacrum in a AP rotation way. So means that a base posterior or a base anterior way. So that's the weakness of the Thompson technique. So the strength, which is they actually have a quite strong test in sacrum rotation. Okay. So when the patient is not responsive to care, try to change your technique or use a different approach. This is how I interpret. So when the patient doesn't seem to improve with your adjustment, maybe you should change another system or another approach to the patient. Or you can send the patient to another specialist. Like for example, this patient needs an ECG, or this patient needs surgery. You have to send them for surgery. Okay, so this is how I interpret. Okay, so the last one is, you guys have to think about this. Chiropractic is not black and white. Okay, what does it mean, not black and white? So you see, chiropractic, I always see chiropractic as a complementary alternative medicine. Okay, that time when D.D. Palmer differentiate us or try to defend chiropractic profession, also state that chiropractic is actually not medical practice. Chiropractic is a alternative complementary medicine. Okay, so I will just show you why it's not black and white. If there's absence of evidence of your care, it doesn't mean that it is ineffective, useless, or false. Okay, especially when you go into semester 7 and semester 8, we tend to ask the intern to explain every single technique, every single treatment they use in research. So you have to show the research to tell us why are you using this kind of treatment? Why are you using ultrasound? Why are you using this? Why are you teaching this kind of exercise? But then I would say, for me, absence of evidence doesn't mean it's ineffective, which it can be means that it haven't explored yet. Because you see, human body is actually very complex. Sometimes you accidentally adjust some patient, the patient get better, but then there's no evidence. You see, sometimes you adjust the headache, the patient coming with headache, right? You adjust the pelvis, the patient get better. What are the evidence here? There's no evidence. Okay, so if there's no evidence, doesn't mean it's false. It just haven't explored yet. Okay, so you guys have to take note of this stuff. And now I'm going to make you guys more confused. If there's a presence of evidence, also doesn't mean that it is effective or useful or it is true. So you see, when I was in my semester 7 and semester 8, when I'm doing my what do you call that? When I'm doing my final year project, which is doing a research. So at first I believe in research a lot. So when the research say yes, it definitely a yes. When the research say no, it definitely a no. But then when I start doing my own research, I realized that research can be biased. You see, if you read a lot of like research from the manufacturer, from the health supplement, or from the pharmaceutical, you see like they will state that, oh, this kind of treatment is very useful. This kind of treatment is very useful. But is it true? We don't know. Okay, a lot of time research can be biased. I'm not saying all the research are biased, but research can be biased. Okay, so when you are reading research, you have to always remember this: absence of evidence doesn't mean that it is useless, but presence of evidence also doesn't mean that it is useful. Hence, you have to think critically. Is it from your experience, is it useful? Or from your experience, is it a bias, what you call a bias research? Okay, so you have to really critically think about this question. Okay, so so the next one I would like to talk about is the difference between a good doctor or a bad doctor. You see, just now I say no technique is superior than each other, right? So during my time, people tends to differentiate good doctor and bad doctor from the technique that they practice. Okay, I be honest lah. During my time, they will say like, oh, Golden State practitioner is the good doctor, or diversified practitioner is a bad doctor. Is it true? Is it true? Is it really true? It's actually not. For me, what differentiates between a good doctor and a bad doctor is that a good doctor know what they are doing, and they know when to stop the care. They know when to refer the patient. They do their palpation. They do their examination properly. No matter what kind of technique they use, they follow the system. They follow the evidence also. Okay, they know when is the best time to refer the patient, so not to delay the patient's care. But what is the bad doctor? For me, the bad doctor is like they tends to adjust just to adjust for the sake to adjust for the sake of cavitation. They adjust without any palpation, without any examination. Basically, they are lazy. Okay, if you are lazy, you are a bad doctor. You don't listen to the patient requirement. You don't listen to the patient history. Yeah, and then you treat the patient in your own way, without treating the condition, or without alter the treatment for every patient, customize the treatment for every patient. Okay, so that's the difference between good doctor and the bad doctor. Okay, you guys can have your own definition, but I'm sharing my opinion on this one. Okay, because I have heard a lot of people during my time try to differentiate good doctor and bad doctor from the technique they use. Okay, so before you continue your chiropractic journey, and after listening my this very subjective based sharing, because I'm just sharing my experience and my opinion into what really is chiropractic, I want you guys to think about some question, because everyone's chiropractic is different. It's totally different. So I want you to think about, why are you take part in chiropractic? Why do you want to become a chiropractor? Why do you want to treat patient? Okay, why don't you become an entrepreneur? Okay, so what motivates you to become a chiropractor? You have to think deeply about this. Is it the cavitation? Like when you adjust, when we adjust the patient, the patient feels very good. Practitioner also feels very good one, because when we adjust, we tend to have like, okay, successful, we create the sound, we create cavitation, the patient feels better. Yeah, this one motivate us to be a good chiropractor, Or it's a patient transformation. After the patient seeing you for 6 to 7 times, or the patient seeing you 2 times, after receiving your adjustment, their condition can actually become better, and then you have already helped them. Okay, so what motivates you to become a chiropractor? And the last one, why do you adjust? Okay, like just now the 3 theory that I gave is just my own personal opinion on why do I adjust the patient. Okay, and what the theory that existing in the chiropractic. Okay, why do we adjust the patient? So so you have to think about this. Why do you adjust the patient? So when you have the mindset of why do you adjust the patient, then you have potentially become a very good chiropractor already. Okay, so before going to Q&A, I would also like to talk about about my business. Like, why do I become an employer instead of become an employee? Okay, you see, like when you graduate from IMU, you have two pathway, you have two choice. Okay, number one, you open your own shop, you open your own clinic. Number two, you become an employee. Okay, so if you become an employee in Malaysia, your annual salary, if you are working very, very hard, okay, it can go up to 10, 20, or more than 30,000. Okay, so if you work very, very hard lah, if you treat a lot of patients lah, the salary can go very, very high. Okay, and why when you become a business owner, here comes the thing where you have to be extremely cautious and you will be extremely busy as well. So for the starting, right, you might not be very good. Okay, so the starting might not be very good because you have to treat patient. In the meantime, you have to manage your company as well. You have to do your account as well. You have to hire more chiropractor to help you as well. So you have to do your own marketing while treating the patient. So basically, it's like in the morning you treat the patient, at the night when you go back, you try to do advertisement. You try to do a sum up of today, and then you try to do a KPI of all of your employee. Okay, this is what makes businessman a little bit difficult when it comes to chiropractic, because you have to do, at the meantime you have to manage the company as well. Okay, so why am I setting up my own company straight after I graduate? Is that I think that I am the one who very easy get influenced by the others. Okay, so I work all the way from semester 1 to semester 8, develop my own kind of philosophy and develop my own kind of treatment plan and develop my own way of adjustment. So when I go into a company, I tend to get influenced by the doctor or by the chiropractor, which is a good way if the doctor is very good. But then I kind of want to continue this journey by myself. So it means that because when you open a business, you see the risk is that when the patient come in, you don't have the ability or you don't have the knowledge yet to treat the patient, or you don't have enough ability to treat this complicated issue. You will tend to, first, if you are an employee, you will tend to find your boss, discuss with your team. But then when you become a business owner, you own a chiropractic clinic, you are all on yourself. So you have to do your own research. You have to go and ask your mentor, or you have to discuss with your team if you have one. So I tend to like to do things in my way, and then I tend to like to search the answer by myself. Because what I'm thinking is that when I become an employee, what I learn from my employer is what my employer learned. It might not be the thing that I want. Okay. Instead, if I come out to become an employer, maybe what I learn is straight from the facts. What I learn is straight from the sources. So I can pick up what I like and throw out what I disagree with. Okay. That's why I become a business owner lah. And then, yeah. So if you want, for me, my suggestion is that when you straight away graduate, I will recommend you, if you are not proactive like me, you can go get a job first before you come into the business field. Because from what I experience right now is that I've been struggling a lot in finding my own system, creating a company, obtain a business license, to find an accountant, and then it's actually very stressful, I would say. But if you can tolerate the stress and you tend to want to search your own answer, you can be a business owner. There's no problem. Okay, but if not, then maybe you can go join a company first, get some experience, and then get through to understand what you are going to adjust, to understand what is your philosophy, and to understand how to create a company. Then you come out to create your own company. Yeah, that's my suggestion. Okay, so until now, I think I have end of my sharing, because this is a very subjective and a very, I would say, personal opinion based type of sharing. So everything that I say doesn't represent IMU and doesn't represent anyone, just to represent myself. Okay, so if anything that I have offend you, or my philosophy is very different from you, okay, so please tolerate lah. Okay, so until now, that's end for my session. Any question?
Okay, so thank you so much, Dr. Angus, for the wonderful talk. So, Dr. Angus, there are only two questions.
Okay.
So the first one was that why not adjust to correct the alignment and the stimulus together?
Yeah, you can adjust the segment to correct the alignment and to stimulate at the same time. But sometimes when there is a conflict between each other, then you have to decide which one you have to adjust. Like for example, if you want to stimulate the sympathetic system, okay, so for example, you want to stimulate the cranial nerve lah, okay, but then there's no restriction in your T2 T6 and T2 T4 to T6, then what will you do? Will you adjust the T2 T4 to T6, or you just leave it? Yeah, so when there's a lot of time, you will have this kind of conflict when you come to using these two type of stimuli. Of course, for me, I always try to adjust the spine and at the same time stimulate the system as well. But then you see most of the time when the patient react very differently when you adjust a different segment. Yeah. Okay. Have I answered the question?
I think shall we proceed to second question?
Sorry?
Shall we proceed to the
Yes.
Yeah. So it was from N5. Yeah. She was asking, do neurological philosophies mean sometimes patient will live with the same mechanical symptoms and complaints as when they came to see you?
Sorry, I don't get your question.
Okay, sorry. Do neurological philosophy mean sometimes the patient will live with the same mechanical symptoms and complaints as when they came to see you? Or do
I cannot really answer the question from like but I can only answer the question from my experience or from what I've been reading lah. Okay, so basically when we adjust to stimulate the patient, when we adjust from my philosophy lah, okay, when we stimulate the certain nervous system, the body will start their healing lah. Okay, the body will start to heal itself. Okay, so all the biomechanical, because you see, when you are very straight neuro, right, you think that, oh, most of the subluxation, or I would say like most of the biomechanical symptom is actually from the inhibition of certain nerve. Like in the most common one would be the PNRF, which is the pontomedullary reticular formation in your brainstem. So when we adjust to stimulate this brainstem, it tend to reduce the flexion posture. So what we see is like when there is a flexion posture, your PNRF is inhibited. When we stimulate the PNRF, the flexion posture will become more extension. So your slouch posture will become more extension by the time the biomechanical issue has been fixed as well. So that is how we think about, how I think about this one lah. So when there definitely has a chance where you treat the patient in a very neural-based activator, AK without any manual adjustment, then the patient still come back to tell you, hey, doctor, I'm still having this pain. By that time, maybe you have to change your approach. Maybe you have to change what kind of application you use. Maybe you have to change, maybe you need to think, because if you are patient-centered doctor, right, you have to think, oh, is it my application? Is it this neurological base are not treating the cause, the root of the disease? Are just treating the symptom of the disease? Because either your nerve induce biomechanical dysfunction, or your biomechanical dysfunction induce your nerve dysfunction. This is a question where there's egg first or chicken first lah. Okay, so when the patient doesn't responding to your care, you have to question your application. If you have changed several times your application, the patient still not getting better, you send them to X-ray, you send them to MRI, the patient is still the same, then maybe it is out of your practice of scope already. Maybe you have to refer to others, or maybe you need to check more, maybe systemic issue or internal organ issue, any systemic disease, immunity disease. Yeah. Okay.
Yep, I think you got it. Thank you so much for the answer, Dr. Angus. Now, here come the third one.
Okay.
It's from Lincoln. May I know how much in terms of cash should I expect to start up my own chiropractic business?
How much? Wait. Okay. Okay. So for what I think is that what kind of practice that you want to be. You want to become a very, because you see, most of the money, right, most of the startup cost is actually spent on the chiropractic table and the renovation, and also the marketing, You see, if you want to create a Sendian Berhad, you find an accountant and a secretary, it's only cost you like 3,000 to 5,000. Yeah. But then when it comes to chiropractic table, then it's a very big issue. If you want to buy like the China table or the Thule table, then of course, it will be very cheap, like 4,000, 5,000, you can get a chiropractic table. But if you want to get flexion, distraction, you want to get high-low, you want to get rotation, you want to get like the scoliosis kit, then it will cost a lot. So like the table you use in IMU, the elite table, one table costs around about 30,000 for one, the elite table that we use in IMU. The flexion leander, flexion distraction table with scoliosis kits cost about 45,000, 46,000. Yeah. So the high-low table can go up to like 90,000 in Malaysia dollar. Okay, Malaysia ringgit, sorry. And then also depends on what kind of machine that you want to buy, what kind of modality you want to buy. Like ultrasound machine is around 6,000 to 10,000. If you get a combo unit, it's like 13,000. And if you want to get a very decent traction distraction table, it will cost about 150,000 for that. So how much cost you to start up? If you want to start up in a very budget way, you buy a Thule table, you buy a Thule simple table, and then you use a simple renovation. At least you need about 100K from my opinion. Yeah. And if you want to do a decent one, very good renovation, 200 to 250K. Yeah, about there lah, about there. So it depends on what kind of practice that you want to practice. Okay. Did I answer the question?
Okay, next question will be from the Lim Pauline. How do you manage when patients feel relief right after adjustment, but the situation keeps coming back even after a few treatment?
Okay, you see, if the patient feels relief after your adjustment and keeps coming back, then you will know you are not treating the cause of the disease, or there is a underlying issue, or there's a underlying disease under the disease. You see, a lot of time the symptom of the patient is very confusing. When I was in the intern, I never see a patient come in with textbook condition. So all of the patient, all of the symptom, all of the sign is overlapping with each other. So when we adjust the patient feels better, and then when they come back, like if this for like 4 to 6 visit, then you have to really question yourself whether your treatment is the best for the patient or is really treating the cause. But provided by from the first to the 6th visit, you are using the same type of treatment, same type of approach to the patient. Yeah, then you need to question yourself, why the patient keeps coming back? Maybe there's a underlying issue, underlying disease during the entire procedure or during the entire treatment. You misdiagnose the patient. So usually what I will do is like I will treat the patient for 6 visits. Okay. And then when during the 6th visit, I will do a re-evaluation for the patient. So I will check again all the orthopedic tests I did and all the neurological tests I did. And then after I test everything, if still the same as the first when she come in, then I will know I have to change my approach. Then I need to send them maybe to X-ray if it's indicated, or send them to MRI if there's a heart neurological sign, or send them to any specialist, medical specialist in this condition. That's what I will do. Okay.
Okay, the next one will be from Alisa. Dr. Angus, I would like to hear from you. How do you explain to the public what is the difference between chiropractor, theta, and bone setter and physiotherapist?
Okay. Okay. First, I will say theta and bone setter. What their philosophy of treating, or why they are treating patient using manipulation, I have no idea. Okay, so I cannot comment on, like, I cannot say, oh, theta is bad, theta bone setting is bad, bone setting is in a different way. The only thing I can say is different. Theta and chiropractor is different, and the way that they treat the patient is different. The philosophy is different. Their science is different. Yeah, because you see, theta and bone setter tends to follow the Chinese medicine philosophy, the Chinese medicine way of treatment. So I can really, okay, if the patient kind of asks me, oh, what's the difference between you and the theta and the bone setter, then I will say what chiropractic really doing. Okay, what is chiropractic? What is the role of chiropractic? Instead of saying like theta is doing what, theta is doing what. Okay, because from what I know, theta and bone setter, they are very biomechanical based. Yeah, they're very biomechanical based. So chiropractor is actually a neuromuscular skeletal specialist. So every adjustment or every treatment we did is actually related to neuro. It's actually using the neuro to help the body to heal itself. Okay, so but what is the difference between chiropractor and physiotherapist? What I will say is chiropractor been through 2 years of basic science training. Okay, and then we definitely learn a lot more about neurology and about X-ray radiology and anatomy as well. So physiotherapy, they are more focused in how does exercise, or how does it, yeah, how does it exercise, or how does the a modality can help you in your new muscular skeletal way. Of course, there's physiotherapy doing a stroke rehab or anything, but then our approach is very different because chiropractor is a neuromuscular skeletal specialist, and physiotherapists, they are more focused on muscular and skeletal. Yeah, just bone and muscle. So we are more in like nerve, bone, and muscle, and how to relieve the nerve tension to let the body to heal itself. Yeah, that's how I will explain to the public for the difference between these four professions.
Okay, thank you, Dr. Angus, for the sharing. And next, from phone 3334, Dr. Angus, were you saying that Gonstead chiropractors are not patient based? So should I look for what technique chiropractor?
No, I'm not saying that Gonstead chiropractor is not patient based. I knew a lot of Gonstead chiropractor, they're actually listening to what the patient say. Maybe I shouldn't use a example of the technique to actually as an example lah. So okay, Gonstead or Diversify or SOT or Activator, there must be some doctor, they are not doing a patient-centered care. Okay, so you have to know about this. So I'm not saying that all Gonstead chiropractor or all Gonstead chiropractor is not patient-based, or I'm not saying that all Diversify chiropractor are patient-based. It's different. Okay, I'm just giving an example. Is like there are good doctor who pay attention to the patient, and they are normal doctor, ordinary. We cannot say the doctor is bad just because they didn't listen to what is your concern, or like they didn't treat your disease. Because in chiropractic, the main focus of us are still the spine. Okay, back to the basic, we still check the spine no matter what happened. No matter you have a hand pain, no matter you have knee pain, we still check your spine. Okay, we still fix the alignment on your spine. But then some of the practice, they tends to like my practice, I tend to spend more time with the patient to understand all of their wellness care. Okay, how they eat, what they eat, and then how's their daily living, how's their active daily living. And then I know some of the chiropractic center, they are practicing a very business volume-based practice. Means that the patient come in, they do a basic scan on the spine, and then adjust the spine, and then send the patient out. So it's about like 10 minutes time for the even the initial consultation, or even the treatment is within a very short time of periods. But I'm not saying that they are bad. Okay, I'm not saying that they are bad, but then they're just having a different kind of philosophy. They're just having a different kind of way of treat the patient, different kind of approach. That's why I'm saying that's why I'm asking what kind of practice you want to do. You want to do a patient-centered, or you want to do a doctor-centered? Yeah, that's my opinion lah. So regarding to what kind of technique you should look for, I couldn't say, because you see, chiropractic is an alternative complementary medicine. Your condition might not be suitable for this technique, or your body might not be responding to this practitioner. Or it's the same, no money back guarantee. Like when you go and see a MD, when you go to clinic and see an MD, and then the MD give you a painkiller, your body might not respond this painkiller as well as the other doctor give you another type of painkiller. Okay, so this is very different. So if you have specific condition, there are specific technique that treat a certain condition. Like if you are pregnant, the Webster doing a very good job in treating a pregnant woman. And if you have like osteoporosis, or you cannot tahan manual adjustment, or you're scared of the sound, a drop table or the activator method would be a very good technique for you to go for lah. Yeah, and if you need a very specific adjustment, you have headache, you have a very bizarre condition and you look for a specific manual adjustment, and Gonstead or Diversify will be a very good choice. Okay, do I answer the question? Okay.
Yeah, I think I'll proceed to the next question. If this is from Huawei P30 Pro, yeah. If 30K per month kind of salary, does it mean that the doctor is doctor-based? Because we have limited time and limited ability to treat them also. How do you get 30K then? Unless you see them in 5 minutes only. Thank you.
Okay, you see, if you want to earn 30K per month, okay, so just now what the example that I gave is that if you become an employee, if you work very hard, you can get 10K, 20K, and even 30K K salary. Yeah, of course, if you work every day from morning to night, 12 hours each day, and then your charges is like 150 per treatment, and then one treatment half an hour, and then add on your company commission is high, 60%, 70% with a very high basic salary, and or you are partner, you become an associate chiropractor or a partner chiropractor in a clinic. Every single clinic sales has related to you. Of course, you have the potential to earn about 30K per month. Yeah. So this one really depends on how you earn your money, because you see, chiropractor doesn't only treat patient also only. We don't really actually only treat patient. Okay, there's a lot of stuff that we can do. We can do public education, we can do seminars, and we can do we can treat the patient, we can teach the junior, we can have seminar and stuff. So a lot of things that a chiropractor can do, because we have the knowledge. So how much we can learn per month is really depending on how creative you are, and can you actually target the demand of the market, and is the referral, is your patient keep referral patient to you. So that's how I think how do I get 30K per month. That's my answer.
Okay, thank you so much, Dr. Angus. Next, what is from Lim Pauline? What do you do for wellness patients?
Okay, so in my practice, I have several patients. At least I have several patients coming for only wellness care, which makes me a little bit headache, because when we are in intern, when a patient comes in with wellness care, we are actually quite difficult to write our reports, because that one you will know when you get into intern. But then yes, if the patient come in with wellness care, you have to know health consists of 3 elements. Okay, so the first thing is obviously your physically. So what you do every day, how you sit, what's your posture, and the second one is obviously your mental. So are you in stress today? Do you drink enough water? Do you sleep enough? And are you happy today? How's your mental going on? And then the last one would be the chemical, which is what you eat today, what supplement you took, and what are you drinking enough water? Do you eat a lot of fried food? Do you eat a lot of fast food? So what I will do for wellness patient, basically for my level now, is to give them a basic screening for the physical element. So I will see whether there's any subluxation, any nerve dysfunction in the body. And then the second, I will go into their, also in the physical element, I will also ask about their physical activity, look at their BMI, weight and height, see whether they need to reduce their weight. And then for the mentally, for the chemically, I will also look at what's their basic meal, and then what they eat. Do they took any supplement? Do they need to take any supplement? Do they do regular blood test checkup? And then for the mental part, right? I am not a psychiatrist, and I'm also not a psychologist lah. So basically, we can't do much about the patient in their mental part. But then when a patient come in, usually our words will be like a mental support for the patient, because a lot of time the patient needs a affirmation, okay, an affirmation from an expert. So that's what I will do for the patient lah. So I will just support, ask them, hey, how you doing today? Are you okay? Yeah, so that's what I did for a wellness care patient. Usually wellness care patient come in, I will only want to see them once in a month, or once in 3 months, or once in 4 months, just doing like maintenance care and check out whether there's any issue going on in their body. Yeah, that's what I will do for the wellness care.
Okay, thank you, Dr. Angus, again for the answer. So, from Samuel, have you ever made a mistake during adjustment before? How do you deal with it?
Oh, this is a very good question. I once read a article about doctor before I get into internship. So it state that in order to become a good doctor, you need to, I don't know I don't know the sources already, but I still remember the quote is like, in order to become a good doctor, you have to kill someone. Like something like that. It's very extreme, but then it's also related. So it's like, in order to become a good adjuster or a good chiropractor, you will face some mistake in your life. You will adjust it wrongly, diagnose wrongly, misdiagnose. So what my suggestion is that what you need to do is actually, what you need to do is actually deal with it, accept that you are actually making a mistake, and then any single cause of patient injuries, if can, for my opinion, you need to tanggung lah. You have to bear the responsibility lah on the patient if you accidentally injured the patient. For me, I didn't hurt the patient, but I strained one of my patient neck when I'm doing a adjustment, not a cervical adjustment, it's a upper thoracic adjustment. So I strain their neck. I tell them honestly, I might have adjust wrongly, and then I have overpower your neck and then strain it. So so you seek for patient understanding, because that time I'm still an intern ma. So of course the patient will understand, and then from now, then after that, every single session, actually during my intern time, every patient is about 20 to 30 minutes treatment. So I will give extra time to the patient to make sure he's really doing good lah. That's what I will deal with my mistake lah. That's how I will deal with my mistake.
All right, thank you, Dr. Angus. Here come the last question. Okay, from Tao Yang Tam. Dr. Angus, since your topic today is regarding chiropractic journey, would you recommend chiro student or junior to go for an overseas training program?
Okay, so it's very depends, but for me, I would definitely recommend them to have a training program. Okay, so for me lah, I want to practice in Malaysia, so I tend to stay in Malaysia. But then I just realized that in order to explore yourself more about chiropractic, in order to know more technique in chiropractic, or to know more philosophy in chiropractic, you need, I think, going overseas is a quite good experience because I have friends who are studying overseas. In fact, my batch have quite a lot of people, quite a lot of students in UK now, still in UK now. Their way of thinking and our way of thinking is really different. I would say it's very, very, very different. So the way that the school teach chiropractic is also very different from the way in Malaysia. So I have a little bit of regretting not taking a training program lah. But then I'm thinking if I'm taking a training program, I might not be opening my own business in Malaysia already. So yeah, I think it's like 互补 lor. Okay.
All right. Thank you, Dr. Angus again. So I think that's all for the question Q&A session. I mean, yeah. So
I wait. I saw someone saying they am misleading something. Okay, let me see. Okay, it's phone 334, right? Yeah. So basically, yeah, I think yes, I'm making a wrong example. I'm sorry if I offend anyone here. I'm not saying that a patient-centered and doctor-centered is actually based on any technique at all. What I'm saying is that the time and the attitude that the patient and the doctor given to the patient is different. So in patient-centered and the patient-centered and doctor-centered is totally different. Like patient-centered tends to give what the patient need. Doctor-centered is tend to give what the doctor have. So there is a difference between these two. So I might be doing a very wrong example. So here I will apologize. But then yeah, don't yeah. So I think I clarified the mistake here because it's a public speaking. I noticed that. So yeah, every technique is good. Every technique has their own strength and weakness. So when choosing a chiropractor, you still have to look at the attitude of the chiropractor and how they treat the chiropractor. And is this chiropractor, is the vibe of the chiropractor suit you? Or it, because you see, when doing chiropractic treatment, right, we tend to have a lot of close contact. For example, like when we adjust AP thoracic or when we palpate the patient. So you really need to find someone who you can trust. Then if only you find someone you can trust to treat you, then your body can heal faster. Okay, so that's it. No question already, right?
yep, no question already.
Okay, so I do a little bit of advertisement here lah, huh? Okay, bear with me a little bit. I know quite late already. So my clinic will be opening in November 2020. The location is in Johor Bahru. I'm not sure whether how many of you are from Johor, but if you are from Johor, definitely. If you are coming to Johor, you can drop by my center and maybe let me know you have attend my sharing session, and if anything you want to share to me or you want to talk with me in person in my center as well. My center is in Johor Bahru lah. So you guys can scan the QR code below. You can go into my Facebook page. My Facebook page haven't do my rebranding yet. The logo you see now is a brand new logo. It's very different from the logo in my page. So you as long as you see BP Chiro, then you like and follow us can already. Okay, you like and follow us can already. So I think that's it for today. If you guys have any question, any disagreement, you want to scold me or you want to compliment me, you want to text me in person, or you can just text me. The phone number here is my phone number. Okay, the last thing I want to share is that for student here, like what I said just now, in every single semester, you actually supposed to do something for yourself and in your journey. So in order to become a good doctor, I will really, really appreciate all of you to get to understand your basic science. Okay, to understand your basic science and learn your arts, develop your own arts, and then create your own philosophy when you are treating your patient. That will make you a very good doctor. Pay effort to listen to what the patient need and educate the patient, because in Malaysia, the awareness of treating the awareness is in chiropractic is still very low. I really especially thanks WSD World Spine Day can bring chiropractic to the internet and let everyone know and let everyone to come here and listen to me what really is chiropractic. Okay, so if there's any public non-chiro here, I would like to say we chiropractic in Malaysia are still the fast developing profession. In our profession, we actually make sure that everything is safe before we do the adjustment or before we do the treatment. So every single one of us, we will do examination on you, and we will take good care of you like a family doctor. So do not hesitate to seek for chiropractic care if you have any back pain, neck pain, or you want to seek for wellness care. I know there is definitely some chiropractor here. They are doing some naturopathic medicine. They are doing internal medicine as well. So actually, we chiropractor, our goal in Malaysia is that we wish to serve everyone like a family doctor. So if you have flu, you have cough, you can come over us, and then we treat you we treat you through a suggestion of supplement, some dietary change, lifestyle modification. That is what we chiropractor tends to do, and that is what my company tends to do, to look the patient in a whole, treat the patient in a holistic way, not just like you have neck pain, then we just treat your neck. We actually look the whole of your spine, your body condition, and what you should do. We will give a lot of like dietary lifestyle modification for you. Okay, so I think that's it for today. Remember, healthy spine leads to wealthy life. I'm Dr. Angus. Thank you very much.
Okay, thank you very much, Dr. Angus. Here come with the ending of the webinar. So last but not least, I would like to thank you, Dr. Angus, again for preparing this wonderful talk. And I also would like to thank all of you here for attending this webinar. Before I end this, I would like to inform you all that there is another live webinar by Dr. Eric tomorrow at 6 p.m. sharp. I repeat, tomorrow, 14th of October at 6 p.m. sharp. So see you all tomorrow. Good night, everyone. Stay home, stay safe. Bye-bye.
Bye-bye. Alex, your MC is good.
Sorry?
Your MC is very good.
Oh, thank you, thank you. It's actually my first time.
Very good, very good, very good.
Thank you, thank you. Your thought also.
Still have to improve lah. Okay. Bye guys.
Bye bye.